cycle. I want you to be able to understand chiropractic and the adjustments that we get to perform on folks. So, let's think about this. You're in here today, and well, I have this here safety pin that you get to see, and we're going to draw it out life size for us. But your head, that's your brain, okay? We'll write that in here. And then what else do we have? We have our body, okay? So how do these two get connected? Well, we have a flow of information from the brain down to the body and the body back to the brain. When we were in school, we have a really neat way of explaining this, because this is what we do as chiropractors. It's to really help you understand why receiving the adjustments helps you to live a healthy life, okay? So, chiropractic is really about restoring that connection, because we have constant flow of information all the way down from the brain down to the body, and then the body sends forth those signals back up. Well, most people come into the office because they're in pain. Why are we in pain? Because of maybe some stress or trauma, right? Well, what's going to happen? We're going to have a disconnect. So all of a sudden we take that safety pin, we open it up, and then we got a change in that signal. So let's show you on a more bigger scale here. Put that right up on the wall here. There we go. So now, the safety pin, we got our brain again. And then our body, it's a little bit bigger, so now it has to go on a ChiroThin diet. So here we got that loop, but then all of a sudden we've got some pain. Maybe we're in a car accident. Maybe we had a fall. Maybe a little kiddo learning how to walk, or maybe there is a disturbance somewhere in the body, like digestive issues or hormonal problems, and that disconnect is happening. We're getting signals, but it's not getting back to the brain. Okay, so the brain is receiving information about your surroundings from your body, and then it uses to interpret this information. Well, let's think about this. There's zero effort going on a continual basis from your brain to your body, and without a disconnect. Well, when there is a problem, miscommunication, we have what we call a misalignment. So the shift occurs when there's an interruption on that superhighway of information. And this is analogous of, as we see, to the safety pin being open. Well, the problem here is we have to get it reconnected. How do we reconnect it? Those misalignments occur with abnormal function, joint stress, and dis-ease. So the key is finding out what we need to do to get that fixed. And that is what we do as chiropractors. Our job is to assess the current state of your nervous system through the exam process. Just as you did when you first come to the office, we did a detailed examination, a complete workup on you. And every time you come as a patient, we're having you on the table, we're palpating, touching, feeling the joint motion, where those restrictions are, and restoring. So each time we're making a correction, and thus we're getting it reconnected. That continual flow. Okay, so everybody gets one of these safety pins to take home, so they can show their family that they're connected, and when they're feeling pain or dis-ease, they're disconnected. So that's why they need to make sure they keep their appointments so that they're continually connected, making sure that everything is flowing properly from the brain down to all the cells, organs, and tissues of the body. So let's think of it this way. When we have the area of proper communication, the loop is closed, this is proper alignment, no pain. okay? We're all connected. So what happens if we see that it's changed? It's the opposite. We're subluxated. We're misaligned. We're disconnected. We're dis-ease. So that's why it's important that we make sure our visits are continually taking place so that we can reconnect your spine and your nervous system and the organ systems back to where they need to be, communicating fully without any interference. I really appreciate the opportunity to go over this with you, and you're seeing the changes take place. You know, Susie, you came in with a knee issue, and after a while we saw that your gait pattern was changing. And as we adjusted you, it went back to that normal state. And Debbie, you had those issues with your gut and digestion. And we started adjusting you and fed you the right nutrients with the supplements, and all of a sudden things started to change. How awesome is that, as we can make those corrections and be like it never was before? I mean, it just is awesome to make these changes. We're fearfully and wonderfully made, and we want to continue to keep you connected. I look forward to seeing you on the next class. Thanks for coming, everybody.